Sup YouTube, Larry here, aka Buff Hippie representing Natty Fit. Just wanted to do a follow-up on that steroid piece that I did last week. So a subscriber got a hold of me and he wanted me to go really in-depth, paint a picture of those serious life-threatening side effects. So again, I worked in the ICU as a nurse for 6 years. I've seen all types of deaths. So anyways, but before I do that, just kind of wanted to talk about the more common mild side effects of steroids. So the first one is acne. They'll experience anywhere from mild to severe acne. If it's really bad enough, they'll go on Accutane. Again, Accutane is like the strongest pharmaceutical drug for acne. I've taken it 3 times, didn't work for me. The Candida diet ultimately worked for me. Again, acne, very, very psychologically scarring. It's on your face, first thing people see. So anyways, it sucks. The second side effect that's common is balding. So even if it doesn't run in your family, a lot of these guys sometimes will experience some type of balding. If they're currently balding, it's going to accelerate their balding. Another side effect is gynecomastia. So gynecomastia essentially is man boobs, bitch tits, and in severe cases, the only cure is to get some type of surgery for it, to get it fixed. So that's going to suck. And the last common side effect is testicular atrophy. So testicular atrophy is when your balls shrink. So you're injecting yourself with this synthetic testosterone. Your balls is usually responsible for making your testosterone. Since you have so much available, they essentially shrink down and they stop producing as much. They stop producing testosterone. So yeah, that's pretty much the more common side effects. So on to the life and threatening or more serious side effects of steroids. So the first one I want to talk about is heart failure. So heart failure usually is a result of multiple heart attacks or from a severe heart attack. And what essentially happens is that the heart usually loses its ability to pump effectively throughout the body. And this manifests in many ways. So a lot of times you'll see these patients, they'll have fluid kind of throughout their body, so a lot of edema, and they'll also have a fluid buildup in their lungs. And a lot of times you'll see these guys, they're like huffing and puffing, they're really struggling to breathe. And if it gets really bad where the fluids really fills up their lungs, it's almost as if they're drowning. So if you can imagine, if you've ever swam and you were underwater for a long time and you were gasping for to surface, it can be really scary. These patients, they're just delirious, they're very anxious, constantly like asking for help. Anyways, and in severe cases, we're gonna have to support the breathing. We'll put them on a BiPAP, or we'll end up having to ventilate them. And when we ventilate them, we end up having to sedate them. And the machine ultimately will breathe for them up until the time we get the fluid out of the lungs. So it's very horrific. It's very scary for the patient, and again, it can be very life-threatening. As far as quality of life, I mean, these patients have poor activity tolerance. They're struggling to just get up, walk. So again, you wouldn't want that at all. All right, so the second serious side effect or life-threatening side effect from steroids is stroke. So depending on the extent of the stroke, if it's mild or severe, if it's mild, they may actually just come out perfectly fine. If it's kind of moderate, they'll have some type of disability. They can have all types of disabilities, from speech, from like slurring their speech, difficulty swallowing. So a lot of times they'll have to go through some type of occupational training, or with a speech therapist, how to swallow properly. A lot of times they're really high risk for choking because of that too. Another common disability is mobility. So they'll be, if a lot of times they have a stroke on the right side, they'll have some left-sided weakness, or they have a stroke on the right side, the opposite. Inability to move their arms and move their legs. A lot of times they're going to have to go on rehab, some type of rehabilitation program. they may or may not get the full mobility back. So it's going to be very extensive. Sometimes it takes years. So again, this could really affect, your overall quality of life. And, a lot of these patients, they need complete assistance as far as, just doing simple activities, tying their shoes, using the restroom. So again, you wouldn't want that at all. All right, so the third serious life-threatening side effect from steroids is kidney failure. So we have two kidneys. So essentially, if both your kidneys fail, you're going to have to go through what's called a form of dialysis in order to survive. So anyways, there's a lot of dialysis centers out there. So you're going to have to go to this dialysis center. Essentially, you're going to be, hooked up to a machine, and the machine it's going to act as a kidney, and it's going to clean your blood, and you're going to have to do this about 3 times a week, and the treatments last anywhere from 2 to 4 hours. I personally haven't seen a patient die just solely from kidney failure. I've seen a lot of complications from it. But I did read up on it. Ultimately, what happens if a patient doesn't do some type of dialysis, the toxins in their blood will build up, and they'll become really lethargic and eventually go into a coma. But as far as quality of life, I mean, if you have kidney issues, you're gonna have to go on some dietary restrictions. A lot of times they have a lot of electrolyte imbalances. So if you have any cardiac issues, that could affect your cardiac. If you have high potassium, high magnesium, phos, and everything, yada yada yada. But yeah, again, and you're gonna be on fluid restrictions. Overall, gonna suck as far as your quality of life. So the last serious side effect that I kind of wanted to talk about was liver failure, and in my opinion is the most horrific and the worst of the 4. So first off, you become jaundice. So what is that? You're yellow. So the bilirubin that's usually peed out, will make sure you pee yellow, is expressed in your skin. So, and it's kind of crazy, like these patients actually smell like pee because of it, and they're very itchy, very miserable from it. And another side effect from liver failure is abdominal ascites. So what is that? So essentially these patients, they look pregnant, and it's just because of fluid that's filled up their abdominal cavity. So with liver failure, you kind of lose the ability to metabolize proteins properly. So your ability to hold in fluids in its right space, you kind of lose that ability. So a lot of fluid shifts out, and in these liver patients, it shifts out in their abdominal cavity, and it looks like, again, they're just these men that they look pregnant, and it's very uncomfortable. And in order to get that fluid off, they have to essentially go through a paracentesis. And that's a special procedure that's done with a doctor. A big needle is placed into their abdomen, and the fluid is drained out. Third side effect from liver failure is hepatic encephalopathy. Sounds really fancy, but what ultimately happens is the ammonia that your liver would have broken down is not broken down, so it builds up in your body, essentially goes to your brain, and it can cause severe confusion. And if the ammonia builds up enough, it can actually cause the patient to go into a coma, ultimately die. Over again. So another side effect from liver failure is cirrhosis. So cirrhosis is pretty horrific when it gets pretty bad. So with cirrhosis, it causes a lot of back pressure, and because of that, it makes a person prone to esophageal varices, which are essentially the veins that line your esophagus, and it makes them prone to ulcers. And in severe cases, the pressure can cause these veins or these ulcers to bleed out. And when they bleed out, they bleed out. I've seen it, patients with projectile blood vomiting, and it looks like The Walking Dead. And I've seen it where they have blood coming out of their mouth, they have blood coming out of their anus from their ulcers, and ultimately, these patients can bleed out. And this is actually how a lot of them die. They actually die from bleeding out everywhere. So along with the cirrhosis, with all the pressures and them bleeding out in their esophagus, bleeding out in their stomach, on their ulcers, they also have bleeding tendencies. So your liver has the responsibility of making a lot of your clotting factors. So since their liver is not functioning properly, then they lose these clotting factors. Your clotting factors is what causes you to form a clot, ultimately stops you from bleeding or stops a bleed. So since they don't have that, if they start to bleed, they can't necessarily stop the bleed. So it's an emergency situation. We're gonna have to go down and kind of clip the bleed. Anyways, I've taken care of these patients, and it's, again, very horrific, very, very crazy scene. So anyways, guys, that's it. I hope it wasn't too graphic, and I hope this is what the subscriber was hoping to hear and for me to discuss. So anyways, again, as always, like, subscribe, comment. Till we meet again, stay natty fit. Alright guys, bye.